A warm good morning to one and all. I'm Vaishnavi of class 9 to give you information about COVID-19. As we all know that we are going through a tough situation nowadays. Everyone is being affected by this COVID-19. Some people are suffering with this COVID and some are dying due to this COVID. In March 2020, the World Health Organization declared COVID-19 as a pandemic. Coronavirus disease is an infectious disease caused by a newly discovered coronavirus. COVID-19 was first discovered in Wuhan at China. Later, it spread to more than 80 countries. In India, COVID-19 was first reported in Kerala. Following the first case, the government announced that all persons who have come from China will be tested for the virus as it has an incubation period of 14 days. It has also prescribed 14-day home isolation regimen and advised that trips to other countries should be avoided. Most people infected with COVID-19 virus will experience mild to moderate respiratory illness and recover without requiring special treatment. Older people and those with underlying medical problems like cardiovascular disease, diabetes, chronic respiratory disease, and cancer are more likely to develop serious illness. The best way to prevent and slow down transmission is to be well informed about COVID-19 virus, the disease it causes, and how it spreads. Protect yourself and others from the infection by washing your hands for more than 20 seconds. The COVID-19 virus will spread primarily through droplets of saliva or discharge from the nose when an infected person coughs or sneezes. So it's important that you also practice respiratory etiquette.
Experts believe the virus that causes COVID-19 spreads mainly from person to person. There are several ways this can happen. When an infected person coughs or sneezes, the droplets called aerosols carry virus into air from their nose or mouth and someone will breathe it into their lungs. Research shows that the virus can live in the air for up to 3 hours. It can get into your lungs if someone who has it breathes. Another way to catch the new coronavirus is when you touch surfaces that someone has virus has coughed or sneezed on, and you may touch a countertop that is contaminated and then touch your nose or eyes. Sometimes through community spread, that means close contact with sick person also get that virus. Research has found that although children tend to get infected with the coronavirus less often and have milder symptoms than adults, they can still catch and spread it. Some have become seriously ill and even died.
COVID-19 is a respiratory condition caused by a coronavirus. Some people are infected but don't notice any symptoms. But about 1 in 6 will have severe problems such as breathing trouble. The most common symptoms of COVID-19 are dry cough, tiredness, and fever. Some people may develop more severe forms of the diseases such as pneumonia. Other symptoms that are less common and may affect some patients include loss of taste or smell, aches and pains, headache, red eyes, diarrhea, or skin rash. Children have similar symptoms to adults and generally have mild illness. People who are older have a higher risk of serious illness from COVID-19 and the risk increases with age. People who are existing chronic medical conditions also may have a higher risk of serious illness. Certain medical conditions that increases the risk of serious illness from COVID-19 includes serious heart diseases such as heart failure, cancer, diabetes, chronic kidney diseases, pregnancy, etc. The signs and symbols of coronavirus diseases may appear 2 to 14 days after exposure.
To prevent COVID-19, clean your hands often, use soap and water or an alcoholic hand rub. Maintain a safe distance from anyone who is coughing or sneezing. Wear a mask when physical distancing is not possible. Don't touch your eyes, nose, or mouth. Cover your nose and mouth with your bent elbow or a tissue when you cough or sneeze. Stay home if you feel unwell. If you have a fever, cough, or difficulty breathing, seek medical attention. Calling in advance allows your healthcare provider to quickly direct you to the right health facility. This protects you and prevents the spread of viruses and other infections. Masks can help prevent the spread of virus from the person wearing the mask to others. Masks alone do not protect against COVID-19 and you should be combined with physical distancing and hand hygiene. Follow the advice provided by your local health authority.
To date, there are no specific vaccines or medicines for COVID-19. Treatments are under investigation and will be tested through clinical trials. Currently, only one medication has been approved to treat COVID-19. No cure is available for COVID-19. Antibiotics aren't effective against viral infections such as COVID-19. Researchers are testing a variety of possible treatments. During this lockdown, we have learned many things. During this COVID period, drink plenty of fluids, drink enough water, get plenty of rest. You should isolate yourself at home if you have any symptoms of coronavirus. Use over-the-counter medicines to treat some of your symptoms. Everyone should maintain a healthy diet, sleep, stay active. So, remember that prevention is better than cure. Stay home, stay safe. Thank you.